You know, we hear the term OCD thrown around all the time, right? But what does it actually mean? Well, in this explainer, we're going to move past all those casual stereotypes and really try to understand the reality of obsessive-compulsive disorder, based on what the research actually tells us.
So right off the bat, we've got to clear something up. That phrase, "I'm so OCD," people use it all the time to talk about liking things clean or being organized, but this slide lays it out perfectly. The clinical reality is a whole different world. OCD isn't just a preference. It's a condition that causes real, significant distress. It can eat up hours and hours of a person's day and seriously get in the way of just living their life. Okay, so that brings us to our first really crucial point. We have to separate the idea of a personality trait from what is a clinical diagnosis. And this right here, this gets to the absolute heart of the disorder. People with OCD aren't choosing these behaviors. The compulsions, they aren't some quirky habits they enjoy. No, they're a desperate attempt to try and manage and neutralize this overwhelming, intrusive, and honestly, often terrifying anxiety. It's a battle, not a preference. And you can imagine, that internal battle has very real, very tangible effects on a person's day-to-day existence. So, let's take a look at what that impact actually looks like. I mean, it makes sense, right? When rituals and obsessive thoughts are taking up so much time and so much mental energy, it's no surprise that other parts of life start to suffer. School performance can drop because it's just so hard to concentrate. Relationships can get really strained, especially if someone starts avoiding situations that trigger their anxiety. And even the most basic things, like getting a good night's sleep or just being able to relax, can become incredibly difficult. This quote is just so powerful. You see, a lot of people with OCD have what's called insight. They know on a logical level that their obsessive thoughts might not make sense, but knowing that doesn't just switch off the anxiety or the overwhelming urge to perform a compulsion. They feel trapped. And that feeling can lead to this intense shame and isolation, especially if they feel like nobody in the world could possibly understand what they're going through.
But here's what I think is the most important part of this whole explainer. There is so much hope. The really good news is that OCD is a very treatable condition. There are clear, evidence-based ways to manage it effectively.
And the great thing is, there's a whole toolkit of effective strategies. First up, you've got cognitive behavioral therapy, or CBT, which helps people learn how to challenge the thought patterns that fuel that cycle. Then there's something called ERP, exposure and response prevention, and this is really considered the gold standard. It's where a person is safely, gradually exposed to their triggers while resisting that urge to perform a compulsion. And what's amazing is that over time, this actually retrains the brain and the anxiety starts to decrease. Medication can also be a huge help. And of course, having a strong support system is just vital.
So that brings us to a really practical question, right? If you know someone with OCD, how can you actually be a part of that support system? What can you do that genuinely helps?
Okay, first and foremost, be patient. This goes right back to what we talked about earlier. Just reminding yourself that these behaviors are symptoms of a disorder, not willful choices. That is the absolute foundation of compassionate support.
And this one is a big one. Please, avoid trivializing the term. When you use OCD as a punchline for being neat, it can make someone who's dealing with the actual disorder feel completely misunderstood, totally dismissed. It just minimizes their very real struggle.
You know, the fact that you're watching this right now is a fantastic start. Seriously, taking the time to actually learn about the disorder is one of the most powerful things you can do. The more you understand the why behind the behaviors, the more effective and empathetic your support is going to be.
And finally, just listen. You don't have to have all the answers. You don't have to try and fix them. Just creating a safe space where someone can talk about their fears without being judged or criticized, that is an incredibly valuable gift.
So, as we start to wrap this up, let's just bring it all together with one final essential message.
If you remember one thing, remember this. OCD is not a personality quirk. It's a real, serious mental health condition. But, and this is a big but, with the right treatment and the right support from people who get it, people with OCD can, and absolutely do, live healthy, successful, and totally fulfilling lives.
So I'll just leave you with this question to think about. After everything we've covered, what does true compassion for someone with OCD actually look like in your life? How can you turn this new understanding into action?